We're facing an invisible killer. So we need to see every road, every place where COVID is spreading. The only way to track the movement of the disease is to test, so we can follow the infections and trace those that may have it. Now, after so many deaths, the UK is relying on this system to keep us safe as we come out of lockdown.
I think it's a real worry that we are lifting the lockdown restrictions in a slightly sort of shambolic fashion without a proper test, trace and isolate system. Everyone wants to get out of lockdown, but we need to get out of lockdown safely, otherwise we're going to see mini flare-ups, epidemics around in regions, and people are going to die as a result.
So far, the data suggests our testing hasn't been impressive, only detecting around 1 in 4 infections in the community.
We've already reached a target of 10,000 tests per day as committed.
For most of this crisis, testing has been about numbers.
We're ramping up the testing with capacity now at over 73,000.
The number of tests yesterday, on the last day of April, was 122,347.
I think it was helpful, and from a situation where we didn't have enough testing capacity, I think that decision to target 100,000 and to really throw everything at getting that transformed the testing capacity that we had.
The ambition clearly is to get up to 200,000 a day by the end of this month, and then to go even higher.
Of course, more tests are better than fewer. But some say focusing just on daily targets is not enough.
Trusts were saying very clearly that they were concerned that the over-obsessive focus on the 100,000 target was distorting what should have been a strategic approach to testing, and that we were just chasing that target, and we were missing the fact that trusts were simply not able to get patients and staff tested quick enough, certainly within the 24-hour international standard turnaround time.
The pursuit of big numbers was about a government trying to fight back from a bad start. When COVID first hit, the UK didn't have enough testing. We couldn't see the disease spreading. The government then stopped all testing apart from patients already in hospitals.
We will pivot all of the testing capacity to identifying people in hospitals who have got symptoms.
But we needed to urgently increase the number of tests we could do. Rather than relying solely on our public sector labs, the government asked private companies to build a new testing system. It includes the drive-through centres that collect samples and the not-for-profit labs that check for the disease.
So this is one of the new labs that's being used to process COVID tests, and we've been told that here they have quite a high rate of failed tests.
But these void tests are still counted in the government figures. It's usually not the lab's fault. There have been problems with the samples collected nationwide.
Mistakes and kit that doesn't work means that more than 90,000 tests have had to be voided.
Accountancy firm Deloitte oversees the private companies that collect the samples for profit. It says 97% of tests are valid, and that void tests are immediately investigated. Any improvements are implemented as quickly as possible.
I don't think it would have surprised anyone in advance if you had said that in some cases there will be teething problems that will need to be ironed out. Not everything will work right first time. But nevertheless, I think it has been very important to establish that capacity.
There's also a basic design flaw. The private network was built at speed and wasn't fully integrated with the NHS, so test results weren't passed between the two systems. They're sent to the person who's been tested and Public Health England. But local councils, hospitals and GPs are left in the dark.
So if somebody is tested, somebody in this area gets tested, their GP and their hospital won't get to know that data?
No. There is no transfer of data into a clinical record at the moment. I gather there's an aspiration to do that in the next few weeks.
But we need it now.
It would have been helpful to have it a few weeks ago.
How big an issue is this parallel structure and this kind of data black hole? How big an issue is it?
You know, if you assume testing does contribute to our management of the pandemic and that eventually saves lives, if we're not delivering effective testing, then that has to cost lives.
The Department of Health says the public and private labs complement each other. It's working to link test results to patients' records. We've also examined how the tests are taken in the new privately run system. Either you're sent a test in the post or you use one of the drive-through testing centres.
I'm on my way to a testing facility, which is in the car park of Manchester City's Etihad Stadium.
Its staff are low paid. Workers told us they haven't seen a nurse or doctor on site. PPE isn't used properly. And frontline staff have had hardly any training. The words of one worker are spoken by an actor.
I was really surprised by the lack of medical involvement. I assumed there'd be doctors or nurses on site, and I assumed the tests would be carried out by healthcare workers. It's jarring to know the site's not run by the NHS, even though it's written everywhere. The same gloves are used all day by people on entry and exit lanes from what I've seen. It's a hotbed for infection, so we need to take precautions.
I feel the government has made a serious error with the reliance on untried private sector companies to run these drive-through testing centres when they could have chosen to use the expertise already there in our local government, in Public Health England, and build that up instead, because you have there the clinical experts that you need to do this to the right standard.
Deloitte says it doesn't oversee the daily running of the site, but all staff must have the required training for their roles and comply with national PPE guidelines. The Department of Health says it's a fantastic achievement to have built a large-scale testing programme which can now provide a test to anybody who needs one and can deliver more than 200,000 tests per day. 8.7 million tests have been delivered thanks to the public and private sector working together.